Hi everybody. Thank you so much for joining us this afternoon. I'm absolutely delighted to be here to launch our Safer Sleep guidance for Pan-Lancashire. Apologies, we started a little bit late. We had some technical issues, but thankfully we've overcome those now. We are going to be recording this session and we're going to be sending out the slides as well. So I will make a start, just some housekeeping. If people could please keep their cameras off, because we have got over 200 people on this webinar, so we don't want to crash it. Please could you stay on mute? We will, if we have time, hopefully at the end, be able to do a Q&A session with our presenters, which will be part of a panel. And as I just said, the webinar is being recorded, so please keep your camera off if you don't want to be as part of the recording. And the slides will be sent out after the meeting for everybody who's attended with any additional resources. So just to introduce our panel, starting, we've got our chair, which is Mike Leaf, who's our independent chair of the Child Death Overview panel. Then you've got myself, Liz Johnson. I'll be talking about the guidance changes. We've got Debbie Gibbons, lead midwife for safeguarding from Lancashire Teaching Hospital. We've got Felicity Pearson from Specialist Safeguarding Midwife from the University Hospital of Morecambe Bay. Then we've got Alison Reddy-Khan from the Health Visiting Service in Lancashire. And then Jill Broadhurst, last but not least, Senior Family Support Worker at Lancashire County Council. So yeah, this is the agenda. Hopefully we'll have time for, as I say, we've hopefully planned in some time for questions at the end of the session, which will be taken in the chat. Okay, I'm going to move on to the guidance update, which is what we're all here for, I think, to learn about the new Pan-Lancashire Safer Sleep guidance. Okay, so just a little bit of background. So I took over the chair of the Pan-Lancashire Safer Sleep group in May last year. And one of the first tasks that we had was to review the Safer Sleep guidance, which we had for Pan-Lancashire. There was a guidance document for multi-agency professionals, but it hadn't been reviewed since April 2020. So that was one of the first tasks that I was set as the chair of that group and the subgroup. So we started with doing a bit of consultation work. We did consultations with 3 different staff groups, with health visitors and midwifery. We also did some consultation work with parents through our Family Hub network. And we also did a questionnaire with health professionals, and hopefully some of you on the webinar responded to that consultation. We wanted to get staff's views really on how we moved forward with our Safer Sleep guidance. What did staff think of the materials? We provide quite a lot of materials for staff in Pan-Lancashire, and we really wanted to understand how professionals were using those and how useful they were to people. So that was part of the process. And so we set up a task and finish group, a small task and finish group to review the current guidance, which was looking at we reviewed the evidence base and also fact checked what was in our existing guidance documents. We then put a new guidance document together, which we then sent out to consultation. And we got a lot of comments back as part of the consultation, which were really welcome. And we have also been working with BASIS, which is the Infant Sleep Lab in Durham, which some of you may have heard of, and they also reviewed our document for us and gave us a lot of feedback on our guidance document. We then had a couple of meetings as a task and finish group where we reviewed all of the comments that we got back, and we made amends to the guidance document, made sure it was meeting the evidence base, and then it went to the CDOT business group in April, where the guidance document was approved. So we do now have an approved guidance document to take forward for Pan-Lancashire. So what is changing? So I guess the main change will be that our guidance will move in line with national guidance. So it will move in line with the NICE guidance, which was the postnatal guidance, which changed in 2014. And it was also move in line with the guidance that is currently provided by the Lullaby Trust, UNICEF, Office for Health and Disparities, OHID, and BASIS. So it will move in line with that national Safer Sleep Guidance, which is, just put a link to it there, which is the Safer Sleep for Babies, a guide for parents leaflet that's been produced. And it will also move in line with our local maternity and neonatal system infant feeding policy. Thanks, Hannah. So I suppose one of the main changes that people really need to be aware of, that we are moving in line with the national guidance. So the main change will be that in previous guidance, in the 6 steps and in previous parental booklets that we produced, one of the main messages was around the safest place for your baby to sleep is always in a cot or a Moses basket for at least the first 6 months. This is now changed in our Pan-Lancashire guidance to the safest place for a baby to sleep is always in a clear, flat, separate sleep space, such as a cot or a Moses basket, in the same room with their caregiver, both day and night for at least the first 6 months. So it's a little bit of a change of wording, but it is, I know in Pan-Lancashire, people have been really embedded to using the message around the safest place for your baby to sleep is always in a cot or a Moses basket. But we wanted to move our guidance in line with the national evidence base. Thanks, Hannah. And we used some of the information that professionals told us in the consultation and in the questionnaire. So we asked professionals, if you refer families to other sources of information about safer sleep, where do you refer them? And nearly 70% of professionals said that they would refer families to the Lullaby Trust. So it made sense for us that if we're going to be referring families to the Lullaby Trust, that the guidance that we're giving to families is in line with what they would read as part of the Lullaby Trust guidance as well. And there was an awful lot of research and consultation that went on into changing the NICE guidance. There was a lot of evidence that they reviewed. They did a lot of consultation with parents. And they did a lot of research, which was conducted in Bradford and Bristol, that revealed that parents found a large number of infant safer sleep messages to be overwhelming and difficult to implement. And they wanted to move towards recommendations which moved towards messaging, which was around more informed parental choice. And some parents really objected to the authoritative messages around where, that you must not co-sleep. So we want to move towards an approach where professionals will have an open conversation with parents and make sure they are informed of all of the risks of co-sleeping, and definitely when they won't be co-sleeping. And this was really important information as well. It was a survey last year that was done by the Lullaby Trust with nearly 3,500 parents. And that survey showed that 9 in 10 new parents will co-sleep with their baby. However, only 4 in 10 parents said that they were advised by a health professional how to reduce the risk of sudden infant death syndrome if they were co-sleeping with their baby. So we want to move our guidance towards that much more informed approach, where professionals are informing parents of the risks. So rather than just a very hard message around when you don't co-sleep, we want to move towards making sure that professionals can support caregivers to make informed choices, and that when they ensure that these choices are made with a full awareness and they understand the potential risks, as well as understanding how to mitigate and reduce these risks. So as part of our guidance now, we also talk about when caregivers should never co-sleep. And this is really important, that all professionals have this discussion with caregivers around when they should never co-sleep with their baby. And this is part of our 6 steps. But the baby, if the baby was born low birth weight or premature, if the baby has a fever or is unwell, if the caregiver or the partner smokes, if the caregiver is extremely tired, or if the caregiver has drunk alcohol or taken drugs. So we really want everybody to understand when co-sleeping should not take place. As part of the review as well, we looked at some new guidance documents which had come out since the last time that the guidance was updated. So there was out of routine report, which I'm just going to talk about in a little bit more detail. and the Promoting Safer Sleep for Babies in High Risk Groups. And both of these reports made recommendations that areas should move towards an informed choice model of informing caregivers as when they should not co-sleep with their babies. We've also got some new sections in the guidance just for people to be aware of. So we've got a new section around vulnerable families. We've also got a section around children with complex needs and how they can have sleep safety. And that also includes a new assessment tool for children with complex needs. We've also got a new now got two assessment tools, one for children who are under 1 and one for children who are over 1. So the over 1 assessment tool is a new tool which is part of our new guidance document, and it does talk about safer sleep, but it also talks about sleep safety as well for that older age group when they may be looking towards transferring towards a cot bed or a bed. And we've also got a section on safer sleep for babies who have been nursed on the neonatal unit, which is a new addition to our guidance document as well. And I am pleased to say, this is a bit hot off the press, but we have been working with BASIS, the Infant Sleep Lab in Durham, on this document, and they have said that they will be happy to endorse our Safer Sleep guidance document, so we will be able to use their logo on our guidance document, which I think is a real coup for us in Pan-Lancashire. I don't think many areas have got their Safer Sleep guidance endorsed by BASIS, so that's a really pleasing thing to see, that we've been working with a national body on this. So I'm just going to go through, I'm not going to read through all the 6 steps to safer sleep. Hopefully people are aware of our Pan-Lancashire 6 steps to safer sleep. They have been tweaked slightly in the new, on all our materials. So these will be changed on our thermometer, on our cot card and our parental booklet. But these just reflect the new guidance document. So number 2, you'll see give your baby a clear, flat, separate sleep space. I think that was one of the amends that we made. And then number 6, we've made reference to parents contacting their local family hub. So that was one of the amends as well to the 6 steps. But if you don't know the 6 steps, please read them through. These are going to be on all our materials and guidance documents going forward. And just a little bit about the out of routine report. So this just looked at sudden infant death in families with children considered to be at risk of significant harm. And they reviewed all of the cases. So in 11 of the 14 cases, the last sleep was considered to be out of routine. So for example, moving to a different accommodation, it was a family party, arrival of a new partner, people unwell, or people taking drugs or alcohol. So just wanted to highlight that those kind of out of routine situations are really important for professionals to be discussing when they meet with families. It might be that ordinarily, they have a very good sleep routine, but families really need to consider those out of routine situations and have a plan for those situations. So that is part of our assessment tool as well. This was just part of some of the findings of the report were that some families felt that safer sleep messages were inconsistent, and that's one of the really key things I want to get over today. Part of the safer sleep guidance means that having our Pan-Lancashire guidance means that we want all professionals to be giving consistent messages to families. But the guidance also found that pregnancy was described as a reachable moment for professionals. And it was said that they need to understand the factors that influence parental decision making when making choices about safer sleep. And one of the main recommendations from the report was that safer sleep is a multi-agency responsibility. It's not just for health visitors and midwives, it's for all the other health professionals and different professionals that come in contact with those families as well. And yeah, this was just a little bit of information about so we've done a bit of an assessment of the safer sleep deaths that we've had locally in Pan-Lancashire, and these were the risk factors that were identified. And as you can see, the highest risk factors for us in Pan-Lancashire are parental smoking. So all of the 7 deaths that we had in the past year, there was parental smoking involved in those, and also co-sleeping in unsafe environments. So as I said before, it's really important that parents understand what are the circumstances that they must never co-sleep with their babies, and that's a main feature of our new guidance document. Okay, sorry, that was a very whistle-stop tour, but I'm just, I could speak for ages, but I'm just aware of the time. I'm going to hand over to Debbie and Felicity. Thank you.
Hi everyone, my name's Deborah Gibbons and I'm the lead midwife for safeguarding at Lancashire Teaching Hospitals, and
I'm Felicity Pearson. I'm the specialist safeguarding midwife at Morecambe Bay Hospitals. Me and Debbie work very hard to try and promote safe sleep advice. It's something we're both probably too passionate about, and we talk a lot about on our days off as well. So we wanted to come on here today to again promote the changes in the safe sleep guidance. We just want everyone to be aware we are going to talk about a local child safeguarding practice review. It is something some of you might have been involved with, so just to be aware it can be a bit triggering, so feel free to leave and take some time for it. And if anyone's got any queries at the end, let us know.
I'm just going to talk to you about professional curiosity and safer sleep. So today we're talking about the importance of professional curiosity in safeguarding families and promoting safer sleep practices. Professional curiosity is where a person explores and understands what is happening within a family, rather than making assumptions about the family or taking a single source of information and accepting it as face value. Professional curiosity involves triangulating information from different sources to gain a better understanding of family functioning, which in turn helps to make predictions about what is likely to happen in the future. It involves looking, listening, asking direct questions, and holding difficult conversations, which a lot of our professional colleagues find difficult at times. It's seeing past the obvious. It enables a practitioner to have a holistic view and understanding of what is happening within that family and taking a think family approach. It's looking at what life is like for a child or young person and fully assess potential risks, such as unsafe sleep situations. A lack of professional curiosity can lead to missed opportunities to identify less obvious indicators of vulnerability or significant harm. Lack of professional curiosity has been identified as a cause for concern in several child safeguarding practice reviews that have been local to our area.
So we wanted to talk about Lily today because this is a case of a baby that died due to unsafe sleep practices. The reason we wanted to talk about Lily is because it highlights the importance of all the work we all do, and that's across the board. That's not just in health. It touches police, community work, social care. So that's why we wanted to talk about Lily. And like Debbie said, professional curiosity, which essentially some people describe as nosiness, but it is that professional curiosity was a factor found in Lily's death that we could have maybe improved on. So Lily was a looked after child, having been made subject to a care order shortly after her birth. She was always placed in the care of her mother, firstly in a mother and baby bridging foster placement, and thereafter within an assessment unit. Her and her mother moved into their second mother and baby foster placement in January 21. It was here that in February, Lily sadly died. She died after her mother fell asleep with her in her mother's bed at her mother and baby foster placement, and it's believed that Mum co-slept with Lily after drinking alcohol. Next slide, please, Hannah.
Sorry, I was on mute. Prior to Lily's death, staff noted and documented co-sleeping and rough handling of Lily by her mother on multiple occasions. There was at least 4 incidents of co-sleeping noted in the assessment unit at a point where the family were a third of the way through that assessment period. Prior to Lily's death, professionals noted a deterioration in Lily's mother's self-care and a presentation. The review noted poor planning for the transition of Lily and her mother when moving placements. It was felt that that was rushed. The decisions were rushed due to the lack of homelessness that Lily may have been made homeless at that time. In the placement, there was 24. In the initial placement that she was in, there was a 24-hour camera monitoring of the family. This did not continue in the second placement, and there was no review as to whether this was appropriate. The foster carer, she didn't have a clear expectation regarding how to address the co-sleeping. She wasn't informed if she should remove the child from the mother's bed if the baby was found asleep with mother in the bed and they were co-sleeping. So the review found a lack of clarity around concerns raised in relation to co-sleeping, including the specific expectations of the foster carer. There was concerns regarding lack of information sharing between professionals as well.
The review also found that there was overuse of simplistic language, such as pass or positive, in relation to the assessments. And this meant that any concerns that were identified that were significant weren't addressed properly because people saw that final outcome of pass or positive. It also found that the health visitor wasn't aware of the number of co-sleeping incidents that were identified in the mother and baby unit. So she wasn't able to provide that adequate support. And the review also identified there was a prolonged period in which there was a gap in the social worker being allocated to the family as one left, and there wasn't an allocation, I think, for 4 weeks before another social worker was allocated.
So what have we learned from Lily's case? The recommendations for the partnership centred around transition of children and families from assessment units to mother and baby placements, co-sleeping and workforce staffing. Working together. There was a failure within the MDT to work together to plan for a new placement and to ensure all professionals were aware of all the concerns prior to moving from one placement to another. Professional challenge. Following transfer to a new placement, there was no professional challenge or questions asked, and the risk assessment for the placement and plan were not updated prior to moving from one placement to the other. It's necessary to professionally challenge the wider MDT to ensure that all concerns are thoroughly discussed and a plan formulated to reduce any risks that may have been identified. Professional curiosity. There was a lack of professional curiosity around the issues impacting on mothers' behaviour or addressing underlying concerns. Difficult conversations were required to explore decline in self-care. Lily's mother was noted to have a decline in her self-care and risky decision-making in regards to her consuming alcohol and taking Lily into bed with her. There was no reference in the report to maternal mental health and well-being or if the mother had learning needs. There was no reference to whether the information that was given to her on several occasions regarding safer sleep, whether she could take on board that information, retain it, and then put into practice. Robust safe sleep assessments and management of risk factors. Risk for SIDS were addressed and discussed, but it was unclear if they were managed appropriately, such as providing information in a format suitable for Lily's mum. This may have helped reduce the risk of her taking baby Lily into bed.
Thanks, Hannah. So to bring it back to what we can do, and that's all of us, not just health, it's outside, but within as well. Partly is reading your CSPRs, so they're your children's safeguarding practice reviews. They're available online. So the one we've spoken about, we have done the quickest whistle stop tour of Lily's story. There's a lot more to it, and you can find it online. So even if you were to Google CSPR, then Lily, it comes up, but it is on the Children's Safeguarding Assurance Partnership website, so they can be seen. Because I did see a hand up, so if you want to know more about that, just pop your question in the chat. In maternity settings, we have safe sleep assessments really well embedded, but in maternity, we care for these patients, obviously in pregnancy and up to 28 days after. So it's a very small period of that child's life that we're caring for them. So it's very well embedded on our electronic patient record. Most of us use Badgernet in the area, so we do thorough safe sleep assessments. We rolled them out across hospital settings as well, so if a child came through A&E, on the paediatric units, in NICU or special care baby unit, and in urgent treatment centres, and all staff are having training for these safe sleep assessments as well, because it's not just when they're seeing their routine care providers. We work hard to educate and empower caregivers, because ultimately we're not in those houses every day and every night, and we're not the ones trying to get those babies to sleep. So it's educating and empowering parents to make their decisions and keep their child safe. And the main thing is, if you identify a risk factor for sudden infant death in your safe sleep assessment, you need to do something and tell someone. And that usually comes through maybe a difficult conversation, but an open and honest conversation with the caregivers to empower them. Like Liz said before, we're not here to wag fingers and tell people off. It's about empowering. And just a point I didn't say was on this CSPR of Lily, even though it was a co-sleeping, they've made it very clear that the concerns aren't about co-sleeping, it was co-sleeping with the risk factor of drinking alcohol. So just before we put the fear of God into people, there's a really clear statement on that of Lily. But that's it. Thank you for listening. I think we're handing over to the lovely health visitors.
Thank you.
Yep, over to Alison.
Oh, thank you for that introduction, lovely health visitors. Hi, my name's Alison Renican. I'm one of the clinical practice leads and health visitor background here in Lancashire 0 to 19 team. So I hope I'm not going to repeat a lot of things that have been said, but actually sometimes it's that slow drip message, isn't it? And it is that repetition actually does really helps me to remember and learn things. So we've heard that to help prevent further deaths, we need everyone working with families in Lancashire to help ensure that safe sleep advice is followed. And I just wanted to add in that actually since the Back-to-Back Sleep campaign first launched in 91, that's a while ago I know, but over 80, it's been reduced, SIDS has been reduced by over 84%. I just thought that was really key. And as public health nurses, that's a key part of our role, preventing future infant deaths by informing families of the risks of unsafe sleep practices. And how can we do that? By maximising the ability of caregivers to implement those safer sleep practices, and by providing staff with that, we just heard that earlier, that evidence-based research to support the discussions, making sure there's consistent advice about safer sleep to mitigate any risks. So we complete risk assessment tools with the families to assess the sleeping environment and the parenting capacity. Thank you, Hannah. And we do this, the health visiting service, practitioners. We see all families and infants at key contacts and routinely provide this safe sleep information. So we see people at the antenatal appointments, new birth, 6 to 8, 1 and 2 year contacts. So we see everybody at least 5 times. And we obviously offer other appointments in between that time to support families. We also offer group sessions as well, such as the antenatal birth and beyond, for parents, using those resources from the Lullaby Trust and ROSPA. So the risk assessment tool is completed with families to assess the sleeping environment and parenting capacity, which is then used as a basis for discussion to reinforce those safe sleeping messages. And this is now recorded in each child's red book. The red book, you get a red book when you have a baby, when you leave the hospital, and it's given to the main caregiver following the birth of their baby. And there's an entry in there now that is included in every red book across Lancashire. The tool involves mapping using those risk factors, which you just discussed. I think that's on it's on this slide, thank you. When we look at the issues regarding about the child, such as we heard about premature babies, about parenting capacity, we've just heard about the alcohol misuse there, substance use, smoking and mental health, and also look at the family environment. We look at the baby's position, we look at sofa, clutter, excess cover, swaddling, and also domestic abuse. So it allows that practitioner to identify and therefore support families who are most at risk of unsafe sleeping and sudden unexpected death in infancy. But it's not about how many boxes are ticked. All risk factors are they're all risk factors in their own right. And if there's any risk factors, we're able to not only just have a conversation to check the family are aware of the safe sleeping advice, but also check their level of understanding of both advice and why it's important to follow it. Every sleep needs to be safe sleep, both day and night time. Just heard that earlier. Sleeping away from home, change the routine, just mentioned that as well earlier. And those safer sleeps for emergency situations that can occur time to time for families. So we not only ask where your baby slept last night, but also where did your baby wake up? And if a baby's caregivers do choose to sleep anywhere not designed for sleeping with their baby, such as a sofa, chair or beanbag, it's made very clearly that the risk of SIDS is 50 times higher for babies when they sleep on a sofa or armchair. So the Lullaby Trust is great with all the different resources that can be found there. They've translated, they've got easy read cards and they're translated into over 20 languages, which is just fantastic. Also visual guides and information for parents of low literacy levels or anyone that's in crisis, just heard it earlier, who are unable to take large amount of information in text at that particular time. Also exploring what might be preventing the family from following the advice. And this could be a range of things, including advice from wider family members. And so we put that support plan in place, liaising with all the other services nearby. We also consider referring on to other services support, including mental health services, domestic abuse services, and smoking cessation services. Also exploring why they've not engaged before and following up those referrals made. And any concerns, we would follow up with our safeguarding leads within our service. There's some further information on the CDOP Safe Sleep Practitioner Guidance, which I think is fantastic, as well as Lullaby Trust, on products such as different cots and matches and bedding, because actually that's a lot of the questions we do get asked, because there's hundreds of baby products out there, aren't there? And caregivers always assume, or we all assume, that if something's for sale, it's safe to use. So we know some popular sleeping products for babies do not conform to those safer sleep guidelines. There's also information, we discuss things like slings and sling use as well with families. And also if a caregiver do decide to swallow the baby, then we'll go through that current advice with the family as well. We talked about co-sleeping a bit earlier, or sharing the bed. So it's recognised that parents do share a bed with a baby for a number of reasons, and sometimes that is linked with breastfeeding. We know bed sharing also helps to facilitate breastfeeding. I just found a study actually in the northeast of England. It actually showed that 250 families reported that mothers who started bed sharing their baby's first month of life were twice as likely to still be breastfeeding when their baby was 4 months of age, in comparison with women who breastfed their baby in the absence of early bed sharing. But it's really looking at that safe plan, and it's having that open discussion, isn't it, with the family in a non-judgmental way, family-centered way. Because for those committed to breastfeeding, sleeping with their babies becomes one of the means by which mums cope with the frequent nighttime feeding. And also the research shows that breastfeeding is protective against SIDS. The risk of SIDS is halved in babies who are breastfed at least 2 months, as well as the numerous other documented health benefits for mum and baby. So we'll discuss those risks and ensure a safe sleep plan is in place, having a meaningful conversation and using the publications from the Lullaby Trust. There's some really good resources on there linked with UNICEF's as well, caring for your baby at night. But it's important for caregivers to understand there's still circumstances in which co-sleeping with their baby can be dangerous and is strongly discouraged. So if carers have none of the above risk factors and have their baby in bed with them, there's still that small risk the baby could die due to overheating, smothering, or overlay. When it comes to dummies, it's a complex issue. We discuss it with the families if they do choose to use a dummy, because there is some research on that, but we'll have that discussion with the family. And once a child reaches 12 months, the risk of SIDS we do know is reduced, but sleep is still important for support healthy growth, repair, and development of all children. The sleep environment should always be a safe space and free of potential risks. And we've just heard there's now this new risk assessment tool, I can't even say the word now, specifically for older children. I mentioned earlier about we have that multi-agency response linking in, with the referrals and working in, liaising with the different agencies, depending on the needs of the families. I won't go through, you can see on there the different groups of people we work with. And that's a really clear message about the clear, flat, safe sleep space. Could keep your teeth in for that word, haven't you? But I'd just like to end that we're really excited to be currently involved in a research project in conjunction with Bristol University, because we're looking at developing and testing new ways to support families and infants at increased risk of sudden infant death, providing extra resources developed for parents to support them, following the safe sleep guidance for their babies and any barriers they have. So we do know, it was highlighted earlier, there are particularly vulnerable families out there. Thank you very much. Thank you for listening. And I'd like to hand over now to Jill Broadhurst from the Children and Family Wellbeing Service.
Hi, thank you. My name is Jill and I'm one of the community family support workers for the Children and Family Wellbeing Service, and I've been involved in the progression and the development of safer sleep practices and guidance for around 14 years now. My role within the working model of the safer sleep guidance is to ensure that all members of staff across the whole of the county, from the front line to management, have an understanding of the preventative steps to reducing the risk of unsafe sleep practices. So yeah, I've been involved in kind of like the training of staff for a number of years now. Thank you. So we know families, to receive the best support, services need to be joined up and integrated in their approaches, and trusted relationships should sit at the heart of this so that family members know who to turn to and partners to collaborate well. So as you can see from the logo on this slide, our family hubs were launched building on what is already being delivered, providing an integrated and universal family support service for all carers, children and young people. So that they can access early help and support they need to build stronger and more resilient families. So bringing the services together to improve access and improve the connections between families and professionals and the wider services and providers, and putting the relationships at the heart of family support. So it's really important that we're all kind of saying the same things, and so the guidance is consistent throughout, no matter who you're talking to. There is a family hub in each of the 12 districts of Lancashire, and where you will see this logo, which means that hopefully families will start to recognise that they can access information anywhere that is displaying this logo. So we address safer sleep through the work that we do across all the different strands of children and family wellbeing service. So thank you. As you can see, I put the continuum of need kind of like, you know, image on there just as kind of like a refresher. But you all may have well kind of like been in contact with someone from our team as part of a level 3 plan or as part of a universal offer. Children and Family Wellbeing Service are fully committed to ensuring that safer sleep practice is embedded in preventative support, as well as the early help package as well that can be delivered. All staff are trained in understanding the 6 steps to safer sleep and professional guidance to support families in making an informed choice for their own situation around keeping baby safe while sleeping day or night. And obviously with the additional information with the guidance now, we're actually kind of like, you know, we're also looking at sleep hygiene as well with the older children also. So this has now been included in our induction package, and all new staff must access this before they begin their new role in earnest. So at a level, universal level, the community family support workers like myself are working with children and young people via any partnership that is kind of like within your local area. We help to ensure that the right services are provided and responding with the right support at the right time. This can be kind of like in a drip feed. So any kind of like person that's involved with any form of kind of like level 2 support, they can access the Children and Family Wellbeing Service, the community seniors, to be able to support them in that that drip feeding information that you're trying to get through to families. Whether that's kind of like accessing your service as a health visitor, or whether they've got a child at school, or whether they've got a child in a preschool or a nursery setting. So as a children and as a senior family support worker, we strive to ensure settings are also able to offer the advice and guidance to their parents, and so they will be updated on the new and updated practice. Directing nursery managers to encourage the whole team to continue their professional development and ensure that they are fully informed in safeguarding children whilst sleeping. Thank you. So just go on to kind of like the other teams that we have, just to show you the wide breadth of kind of like everybody's literally kind of trained in the safer sleep practice. So we have a team of people that also do the family time. So as you can see from the slide, this is the team that facilitate contact for parents and children who are subject to court proceedings, and the children are looked after by the local authority. So they're also kind of like supporting positive family time through supervised sessions in a safe and caring environment. So for this to happen, Although all children may not be residing with their birth parents, the guidance around safer sleep is essential to share, as children may sleep during their contact. Foster carers are also included in this information sharing network and can ask for guidance at any time. In many ways, carers of this group of children may need the correct information many more times due to chaotic lifestyles or circumstances. So as you can see, it's a really integral kind of part of the support plan moving forward for the children involved with family time. So we've also got our neighbourhood group team as well. So they incorporate safer sleep practice within the groups they deliver in the centre and or as part of a partnership with our health colleagues. So this can be in the format of sessions such as Bump to Birth and Beyond, Parents to Be, Baby Massage and Development Matters. The kind of safer sleep practice is not just something that is delivered before and just after birth. It's one that's continued, and it is part of a discussion and an ongoing conversation that we can have with parents. So we also have a team of delivery support workers, and these are likely to be the person that a family might speak to, or a service might speak to when they're coming into the building. And we absolutely embed the importance for every single member of staff having the knowledge around safer sleep practice. So just the final slide now for updates then. So if anybody can remember this one, this is Paul McCartney and We All Join Together. And this is kind of like just the image just to show that kind of we are literally all joining together. It is a multidisciplinary and multi-agency support an approach to continuing to make sure that safer sleep environments are shared with parents and carers. So Children and Family Wellbeing Service will continue to commitment to the cause, and as a practitioner in whatever service you are, you can approach any member of staff for accurate safe sleep guidance. Family support workers utilise the same assessment templates as our health colleagues, which Alison mentioned earlier on. Because it's likely that a family support worker is going to be in a position to be professionally curious on a more regular basis than what the health colleagues can be. And that could be part of a level 3 plan. The family hubs are a starting point for any family and any partner. Thank you. I shall now hand over
to me.
Back to Liz.
Thank you. And I'm just going to cover, we work really closely with our Lancashire police colleagues as well in Pan-Lancashire. We're really lucky to get their support. And we do have a police officer, Keely Powell, who's part of our Safer Sleep subgroup. She was going to deliver this slide, but unfortunately she couldn't be with us today, but I'll just cover it quickly. So some of you may or may not be aware that our police officers have a prompt on their system. So if they go into the family home, they have a prompt to check a child's sleeping arrangements if there is a child in that house who's under 5 years old. They have a system where they can record it onto their system. If they have any concerns, they do put an alert through our safeguarding hub. So we do get those referrals from the police on quite a regular basis through to the MASH, and then I think they go directly through to the health visitors to do a follow-up with families if the police have any concerns about safer sleep arrangements in a family. So people may or may not be aware that the police are quite heavily involved in our safe sleeping agenda in Pan-Lancashire, just to emphasise again that kind of multi-professional engagement that we have, that we're really lucky to have, I must say, in Pan-Lancashire with different groups. Thanks, Hannah. So I'm just going to quickly cover the next steps. So we will be working with our partners on the Safer Sleep subgroup if they need to review any of their policies. So some of our hospital trusts need to review their policies. Now we've changed our Safer Sleep guidance. We'll be looking to take presentations of our new guidance to all the new place-based safeguarding boards to make sure all the safeguarding boards understand the changes to the guidance. We will be working through all of the previous materials that we had. Some of those we've not managed to update as yet, but we will be working through those to make sure that all of the Safer Sleep materials for Pan-Lancashire are updated. We're going to be working on training, so we've just set up a little subgroup to look at whether we can put some e-learning together for staff, because we're fully aware that it's all right us releasing these guidance documents, but we want to make sure that staff are trained in how to use this guidance and have those meaningful conversations with families. We'll be carrying on with our newsletters. Hopefully some of you have seen the newsletters that we've been sending out, and we're just starting to put together our summer newsletter for Safer Sleep, and that's how we'll be communicating with our partners through our newsletters. We'll be working through the Safer Sleep subgroup to do audits to see how this new guidance is being embedded. And we want to do more consultation work with parents. We did do some consultation with parents as part of the production of this guidance, but I think we want to do more of that and just see how the change guidance and the change messaging is going down with our parents. And we want to do some wider work with partners, so housing, social services, and substance misuse services going forward. A final message from me that we all really, I know we've been said a few times already, but we do need to work together to reduce sudden infant death across Lancashire. We had the seven deaths, and that's 7 tragedies, and we know that most of those deaths could have been avoided. So we really, this is just a plea for everybody to work together to adhere to the guidance from whatever your background is or your profession. And then just on the slides, we've got some links to the guidance. So we've got a link to the new Safer Sleep guidance. We've got links to the assessment tools, so the under one and over one assessment tools. We've got a new slightly tweaked caregivers booklet. And we've got an easy read version as well, which has been updated. We've got 3 posters which are available for use. They've all been updated. They're available on the CSAP website. And we've got the caregivers assessment tool as well, which is Appendix 3 of the new guidance document. And then there's just a few links there to guidance from the Lullaby Trust and also BASIS. And they're some of the references, so if people want to have a look at some of the reports that we've mentioned throughout this webinar, please have a look. And then just to say a few thank yous. So thank you so much to the presenters for giving up your time this afternoon. Thank you to those people who come to the Safer Sleep subgroup. It really is appreciated, and the people who took part in our Task and Finish group to update the guidance. Also, thank you to Rachel Ditchfield. She couldn't be with us this afternoon, but big thanks to Rachel and all the staff who made this webinar possible at the CDOC Business Unit. Thank you to BASIS for working with us on this guidance document. It's been absolutely fantastic working with BASIS, and we hope that will this be a continued partnership going forward. And also thanks to Hannah Dean, who helped me put the slides together for this afternoon's webinar session. I've been trying to answer the question. I know we're running out of time, so I've been trying to answer the questions as we go along, because I know we're out of time. Let me just have a look at the questions. So people are asking about the leaflets and thermometers. So just a quick update on that. There was a bit of a pause in printing the leaflets and the thermometers just while we reviewed the 6 steps to safer sleep, because we didn't want to print any and then do the guidance review and then mean that we couldn't use them. So now that we got the go ahead in April for the changes to the 6 steps to safer sleep, we have started to get some quotes to have those printed. I think the timeline is about 6 to 8 weeks to have those ready and printed. I know people really like the cotcos and the thermometers for giving out to families and the booklets, so we will be getting some more of those printed. So if you normally order those through Rachel Ditchfield, please get in contact with Rachel in a few weeks' time, and she'll let you know when those will be ready to be posted out to everybody. Okay. I'm going to leave it there. If anybody has any burning burning questions, feel free to email myself, and I will do the best to answer those. But we will be sending out the slides, and there will also be a recording of this webinar that you can hopefully share with colleagues. Thank you so much, everybody, for your time this afternoon.